Good morning, everyone. My name is Caroline Preston, and I would like to welcome you to this morning's InterTradeIreland webinar, where we're going to be discussing all things health and safety in terms of the government guidelines that have been put in place in Northern Ireland in response to COVID-19. We'd like to encourage you to make the most of today's event by putting any questions that you may have to our panel. You can do this at any time by typing them into the chat box at the bottom of your screen, and then I will put them to the experts at the end of today's event in our live Q&A. If you are experiencing any technical difficulties, you can also use the chat box for that. These messages won't be seen by everyone, they will just come directly to me. And only one other note from me is that today's session is being recorded so that you and others can access it post-event. So without further ado, I'm going to hand over the floor to Deirdre McGuire from InterTradeIreland. I'm going to invite her to come on camera and come on mic, and she's going to formally welcome you this morning and introduce our speakers today. So good morning, Deirdre. Thank you. I'm going to hand it over to you.
Caroline. Thank you, Caroline. Good morning, everybody, and thank you so much for registering today. We've quite a few registrations on the line, so I really hope that this is of value to you. And we're delighted that we have Rosemary Connolly to deliver this for us today. I know it's been difficult times, and I know that your time is precious, so I'm not going to keep you too long. On behalf of InterTradeIreland, thank you so much for joining. We do have supports to navigate COVID, and I'm going to give you a little bit more information on those. I'll do that in the middle of the presentation rather than doing it now. But just to let you know, there are two supports. One is Emerge, and that's to help you get your sales online. And the other one is Emergency Business Solutions, which will cover lots and lots of things, like if you want information on health and safety, or you're worried about furloughing your staff and you want legal advice, so you need to get cash flow projections. But I'll go into all of that in the middle of the session. Most importantly, thank you so much for joining. Thank you for taking out of your day to do this, and I genuinely hope that you'll enjoy it, and I know that you've got great guidance here from Rosemary. And also finally, thank you very much to Caroline from PKFPM, who's a brilliant host and will take you through the Q&A at the end. So thank you so much, and over to Rosemary.
Thank you very much, Deirdre, for that welcome, and also Caroline for so expertly guiding us all through the mechanics of the webinar. So for all of you joining us, this is a presentation relating to the health and safety aspects primarily of bringing opening up workplaces, moving back into some semblance of normality, and kind of the key issues that arise. And I'm just checking, Caroline, that my slideshow is moving along, or am I?
No, we only see the first screen at present,
yes,
Rosemary. So if you just want to hit next,
yes,
very,
of course.
Yes, that's you. Brilliant.
Yes, got it now. Yes.
Thank you.
So, the key thing to start off, every employer, way before the pandemic, employers, big, small, and in between, will know that every employer has a responsibility to safeguard, as far as reasonably practicable, the health and safety of employees, and that is a legal duty. It's a very important legal duty. It's why you are insured with your public liability insurance. It's why your insurers are concerned every year to know, are there any additional risks in the workplace, etc. And of course, we're now operating in constantly evolving circumstances, really, where the pandemic has thrown up a lot of new and significant challenges. So the reference there is to the Health and Safety at Work Order. It is the primary piece of legislation, and it basically places the onus and the legal liability on the employer, as I say, to provide a safe system of work. Beneath the overall order are various regulations which generally kind of implement that legal duty. You know, they provide the practical requirements that employers must adhere to. There's the management of health and safety of work regulations, and very relevant in the current context are the PPE at work regulations. So, as I say, need to be aware, these are legal responsibilities. They're not opt-ins, they are legal requirements. In terms of how an employer works out, am I actually providing a safe system of work? And particularly in the current climate, the Health and Safety Executive has prepared a generic risk assessment template. Now, this is a lengthy enough document, and many small employers will say that not everything in that document is relevant to them, and that may very well be the case. On the other hand, you could safely say, if you go through the entirety of that document, you will have done a very good job of alerting yourself to what risks do exist in your workplace. Of course, you have to do the risk assessment in the context of having the risk assessment document, but also actually walking the business, walking through your business, identifying potential hazards and risks and so forth. The document itself will not be any good if it sits on your desk and you do it as a desktop exercise. It's very much a hands-on, get down there, walk through your premises. Only you will know the particular specifics applying to your business. So, just to go through the headlines of it, what's it aiming to do? It's aiming to stop the spread of the coronavirus. Who is it aimed at? Your own staff, of course, primarily, but also visitors, vulnerable workers, cleaning staff if you have them. What does it cover? A large range of things: hand washing facilities, cleaning requirements, social distancing. When is it necessary to wear gloves? What should you do if someone becomes unwell? There's a lot of helpful guidance about how to prepare for reopening. A lot of you, I know, are already past that stage now and are back in, but then emphasizing that it's important to do your risk assessment before you bring employees back into the workplace. Suggesting walk around, look for any hazards yourself, think about them. How might they be? How might they constitute a hazard? How might you deal with them? And then put in the appropriate measures into place. And on that, I would say this will be an ongoing duty and requirement. It will not be the sort of document that will simply sit on the desk and that's done and dusted. We are in a constantly evolving situation. And again, I beat back to the fact that the employer has the ongoing responsibility to provide the safe system of work. And that will require you conducting a risk assessment on an ongoing basis, and consulting and speaking with the workforce, because that's the way to address difficulties before they arise. There's specific guidance for example, drivers. Anyone there who has who employs drivers. Not alone are you going to be looking at your own workplace, but you're going to look at where the drivers go to. Are there sufficient, adequate facilities there? Are they facilitated to get a proper break? And a big issue and an emerging issue are mental health issues arising from the natural concerns that people have coming back to the workplace, the concerns that have built up in many people's minds over a prolonged period if they have been out on furlough and so forth. And there's very helpful, straightforward, user-friendly guidance there provided by the HSE, by Northern Ireland Business Info, and from both of those sites you can get the COVID-19 Working Through This Together, a practical guide to making workplaces safer. And I can tell you that document is very practically focused. Now, PPE requirements within the workplace. So not every, and indeed not most, workplaces require PPE equipment at all. But PPE equipment is required where there's no other means of safeguarding a individual's health and welfare. And it's important in that context to note that if PPE is to be provided, it must be readily available. So readily available means everyone must know where it is, and it must be easily accessible. It must be in good condition. That is the employer's responsibility. In terms of good condition, it must, as a minimum, bear the CE mark. It's a European Community Quality Mark, and anything falling short of that standard won't be sufficient, and it cannot be charged for. As I said, not every workplace, not even by any means most workplaces, will need it. The guidance says that if you're already using it, you should continue to do so. And as I say, all employers would be well advised to check those three things: readily available, in good condition, and of course not being charged for. But the guidance goes on to say that it's not beneficial to wear PPE beyond what you usually wear, and the guidance says that's because COVID-19 is a different type of risk, and really the key means of dealing with it are social distancing, hygiene, and having fixed teams or partnering. In other words, staggering and reducing the numbers of people that collect together. And in fact, you're specifically advised against, precautionary use of extra PPE, because that's not seen as helpful. Now, at this stage, I want to just refer back to Deirdre, who had mentioned in her introduction that she would give some more information on the very helpful supports that are available from InterTradeIreland to help employers through this aspect of the return to work. So I might invite you to go through that now, Deirdre.
Yeah, thank you very much, Rosemary.
Yeah.
No, this is great. I'm really enjoying it. Also learning a lot myself. And so I'm sure you'll get plenty of questions at the end. So I'm not asking mine now anyway. But I just wanted to very quickly give you an update on the InterTradeIreland supports. InterTradeIreland, as you know, is a cross-border body, and we have lots and lots of supports to help you in areas of sales and innovation, procurement, lots of trade, so there's lots of things. But in particular today, I just wanted to focus on the COVID supports, and of which there are two. And these are just aimed to help the business get some consultancy advice to overcome some of the issues that they have, okay? And the criteria at the moment is manufacturing and tradable services. You need to be a cross-border trader and an SME. And the first one that I would talk about is eMerge, and so it's to help you get online with your sales, and it's £2,500 worth of consultancy advice. And what it does is it will get you somebody in to help promote and sell online. There are lots of things that it can do for your business. If you want to look at SEO optimization or e-commerce or product listing, or have a look at price match and batch offers, logistics, legal and insurance implications from the online sales aspect, you can get advice on all of that. And it's proven really, really, really helpful for businesses at the moment. And the other one I wanted to mention is the one called Emergency Business Solutions. Again, it's £2,000 worth of consultancy advice to the cross-border trader, and what it does, and it's been there's quite a lot of things that it will help you with. One is, for example, if you're a business and you want to go in and do a proper cash flow analysis and project it out and spend a bit of time on that, you can use it for that. You can use it for an analysis of your supply chain. You can use it if you want legal advice, anything specific that's related to COVID. We've had a lot of companies who've come in and they have, they've asked about furloughing their staff and very worried about that, and maybe worried if they've had to, look at contracts and things. So you can use it. You can use it for that. You can use it for also health and safety. So we're looking to add this in as a category. So if you as a business really need to develop your training, or you're worried about the risk assessments and you would like somebody to come in and look through all of these things for you and your business, we will have the option there as well. So if you do see some kind of training and we don't have that accredited provider, we'll work with you. We'll do our best to get that delivered for you. So lots and lots of things there in that space. And I would say, you know, you've got the local enterprises offices in the south, you've got lots of the bodies in the north, the councils, Invest NI, PKFBM do a brilliant update. So their NI Business Info, you've got lots of support and all of the government supports, which is another thing the InterTrade Ireland support will help you manoeuvre through as well. Use them all. If you're a business, please use them all. You might as well. And all of the details on this information will be given out to you in terms of the InterTrade Ireland offering after this session with a follow-up, and you will get the slides. So that's really it. And the other thing I wanted to say to anybody who's on the line today is that if you are listening today and you think, well, you know what, we really need you to focus on this, because we as a support body, as a cross-border body working to support the SME, are focusing our supports and adapting as well. So if there's ideas that you think, you know, you should be doing this, come in and let us know. Please let us know, and we'll do our best to try and work them through into the supports. And that's kind of really all it is. So thank you so much, Rosemary, and please feel free to ask any questions. Thank you.
Thank you, and I would imagine that is reassuring to a lot of you listening in, and I would encourage you to avail of the advice and assistance that is available. Now, under the heading Managing Change and Employment Concerns, and actually Deirdre just referenced this a minute or two ago, obviously in Northern Ireland, the furlough scheme has provided a very important lifeline, really, since it was first initiated at the end of March. But we're now in a period of transition. And we're moving from the situation where furlough was a reasonably straightforward arrangement where people were at home, they weren't doing any work, and the employer was able to claim up to 80% of their wage, subject to that cap of 2,500 per month. Things are moving on now. We're now obviously in July, and from the 1st of August, employers will find that keeping people on furlough is more expensive than it had been, and that will progressively be the case until the scheme ends completely at the end of October. So a lot of clients are now at the stage where they're having to, I suppose, take decisions that perhaps they postponed really because of the availability of furlough. Importantly, and for a number of employers, helpfully, there is the flexible furlough arrangement, which allows individuals to be brought back a certain period of time. They may be brought back on a 2 or 3 day week or something of that order, paid their normal remuneration for those days, and the employer is still entitled to claim the furlough payment against the other period of their normal working week that they're not actually at work. So that has been helpful to some employers who are hesitant about bringing people back full-time, not aware if they'll have enough work for them. It allows them to bring them back on a short and get some assistance for the days that they don't require their employees to be at work. Now, that having been said, other employers are conscious that work is not going to be the same, that there is simply not the level of business out there that there was when all of this came to pass, and they are seeking advice. Obviously, some people are in a situation where they know they're facing into a redundancy situation, and that requires careful advance planning. I cannot overemphasize the need to have a fair process surrounding redundancy. It is too late when people have been given an indication. Any employer contemplating redundancy should plan ahead, know exactly what the consultation and notification requirements are, and follow the very strict kind of procedures that apply in Northern Ireland and which have got to be followed. Otherwise, a redundancy runs the risk of being unfair, procedurally unfair, and runs the risk of an employment tribunal claim, which no one would want. Equally importantly, if an employer out there is considering reducing hours or reducing pay as an alternative to making people redundant, it is crucially important to remember that you cannot unilaterally alter someone's core terms and conditions of employment. And a core term and condition of employment for anyone is remuneration, i.e. what they're paid, and hours of work. So you cannot simply say to someone, look, there are going to have to be changes and we're going to have to reduce your hours or pay. You must consult with the person and you must secure their agreement. If you secure their agreement, many employees will be only too well aware and realistic about the current climate and all the rest of it, but you must secure agreement before you can lawfully change someone's terms and conditions of employment. And that's very important to remember. Advice and guidance and changes to the physical layout of workplaces and social distancing. Again, there's a lot of guidance out there. When I come to the end of the discussion this morning, I've brought together the key aspects of guidance, which is hopefully helpful in one slide, so that you know if you go to any of those locations, you should find readily available, user-friendly and accessible guidance. But in terms of a physical layout and social distancing, the guidance sets out the various things you should be taking into account. I'm sure all of you are blue in the face listening to all of this, for lack of a better term. Hand washing, reducing activities, using screens and barriers in office premises, using back-to-back, side-to-side rather than face-to-face working. If you've got a larger workforce, think about partnering, fixed teams and so on to reduce the number of people circulating at any one time. Keep issuing the frequent reminders about social distancing, and if it's necessary or it might be helpful and it's practically possible, think about staging arrival and departure times, again just to reduce the number of people gathering together at any one time. I'll skip through the rest of that guidance really, but it's all self-explanatory, additional parking and so forth, and big emphasis on providing adequate and properly stocked hand washing facilities in a number of different locations. Readily accessible is the key thing. So a lot of employers do ask now, what if someone comes back and they're disclosing symptoms? So the guidance states very clearly, obviously, and it's important to remember this, all of us as citizens share responsibilities in this evolving situation. So individuals haven't lost their personal responsibility. Of course, employers have specific legal responsibilities because they are employers and because they operate a workplace. But anyone who has coronavirus symptoms should not go to work. If that is the case, then or if they've separately been told to self-isolate because perhaps they've come into contact with someone then who has tested positive, then they need to follow the Public Health Agency up-to-date guidance on self-isolation. And that applies too for folks who are returning, if anyone has been doing this, from a holiday or business travel. If someone is at work, which is of concern to employers, and starts exhibiting coronavirus-like symptoms, obviously their responsibility is to immediately notify the employer and then follow the Public Health Agency advice on managing the situation for themselves. For the employer, send the person home immediately, support them whilst they self-isolate, check if they're eligible for SSP, pay them contractual sick pay if that's applicable, support their well-being in terms of mental health. Now, the guidance says it is not necessary to close the workplace, but it is necessary to follow appropriate cleaning guidance, depending, of course, upon the nature of your business. So people are also concerned, look, in terms of inquiring about people who have symptoms and so forth and so on, what do we face challenges about misusing data, for example? And again, your point of reference there is the Information Commissioner's Office. And I think the Information Commissioner's Office, which is the public body which regulates misuse of data and can deal with complaints about misuse of data, has kind of helpfully said as a big overarching principle that it recognises we are living in unprecedented challenging times, and therefore they appreciate that businesses may need to share information quickly or adapt their ways of working. And importantly, they're saying the law around data protection doesn't stop that being done. But all it says is, which is what you would expect, everything should be done proportionately. So the key guiding principle is you only seek and retain the absolutely essential information. You don't take anything that is not really required. Again, they have prepared guidance, including, for example, guidance for folks working from home. I would suggest to sometimes employees out of sight and out of mind. I would suggest that employers have a look at that guidance, and specifically any of you who are whose employees are handling sensitive information, do have a look at that guidance. You need to remind people that when they're working remotely, there needs to be a very strict focus on the security of information, and you see all of that, making sure everybody's got the most up-to-date and secure version of the remote access solution, using unique and complex passwords, changing them as necessary. It's all very helpful guidance, but whether they should use their own or a company device and so forth and so on. But as I said at the outset of this slide, the key principle is you only, in terms of information that you might be collecting about whether or not individuals have had COVID or have been in contact with individuals who might have had it, you only collect and use what's necessary. And you have to ask yourself those questions there. Is this information likely to keep the workplace safe? If it's not, why am I collecting it? Do I really need it? Will any test that you're considering administering, will it help you provide a safe environment? And could you achieve the same result without collecting personal information? So if you've satisfied yourself that you do need it, having considered all of those matters, you're not likely to fall foul of the Information Commissioner's Office. Continuing on, keep it to a minimum. Be clear, open and honest with staff about their data. It applies really to everything. If something's done very secretively, people are likely to be more concerned and apprehensive. If you're clear, open and honest, I think the vast majority of people in the current climate are well aware that people are trying to have their safety in mind, basically. And as long as you put it in that context and explain what you're doing, why you're doing it, and that you're keeping it to a minimum, that should be, you shouldn't fall foul of any complaint. Of course, you're going to have to keep it securely, and you're going to have to make sure that you have the right facilities to keep it securely. And you must remember that staff continue to be entitled to know what information you have collected about them, where you retain it, and what you're using it for. So this screen brings together really the key. There is a wealth of information and documentation out there. People have said to me they feel swamped by it. But I try to isolate out on this slide the kind of key information that I feel would be helpful for people to ensure that they've got the baseline provisions in place. So the Health and Safety Executive really have produced a wealth of information. It's very straightforward, it's very user-friendly, and the frequently asked questions, I think, would cover quite a range of people's concerns. I just reference again that mental well-being at work and working from home, because I think it's going to be an issue that's going to emerge as we go along. It's just remembering People may be working at home, but they're still your employees. The Labour Relations Agency, again, that's your point of call. That provides free and confidential advice to employers throughout the entire area of employment law. And you will get readily accessible, user-friendly telephone advice if you need it, and a lot of guidance around things like best practice guidance for conducting a redundancy exercise, best practice guidance for changing terms and conditions. Don't even think of doing any of those big ticket items like contemplating redundancy or contemplating changing people's terms and conditions without making sure that you're up to date on that guidance, because it's an expectation. If you were ever faced with a challenge, it would be expected that you had done that. Latest government guidance, you'll see it comes down the wires every so often. I've given you the link there. The Public Health Agency guidance, again, that's mostly about folk with symptoms and what they should do. And again, it evolves and changes. And Northern Ireland Business Info, I have to say, I'm sure many of you frequently look at it. It's very, very, very helpful. And again, it tends to be straightforward, readily digestible information. That's really, I'm just trying to say, yes, in terms of a health and safety policy, yes, I suppose the concluding, just going to rapidly wind up here because I realise that people may want to ask questions. I think that's important as well. But assessing the health and safety policy, really what that means is you may well have a health and safety policy that you had, many years, because it's a requirement that if you've more than 5 employees, you do have a written policy displayed in your workplace. You're going to have to look at that policy and see, does it need any updating? The HSE, that is the Health and Safety Executive, says, you should continue to assess risk, and, to the extent that your own health and safety policy may not cover all of the risks that are now here, because this time last year, no one was anticipating us being in the situation that we are, then update it if necessary. And again, I think I said this already, but don't think that just doing it once would be sufficient. It's an ongoing legal responsibility that you have to provide a safe working environment. So it needs to be right at the top of the agenda there as something that you're going to be doing on an ongoing basis till we emerge, if we ever do, out of all of this. Training, you should be providing a training. There are quite a few providers out there. You will see that all of your usual trainers who provide safe manual handling training and all of that have all stepped up to the mark really, and are now providing a lot of health and safety focused training. If you're using your own managers or supervisors, obviously they need to have been trained and be competent to deliver that training. And I suppose the other thing to be aware of is that there are particular groups that you'd need to be careful about to ensure that they have been trained in safe procedures. Young workers, if you have them, who may not have the degree of life experience that older workers would bring to the situation. Migrant workers, you need to make sure that they're given clearly understandable instructions and guidance. Vulnerable employees, again, you're going to have to tailor any training perhaps to specifically look at their situation. The Health and Safety Executive has provided a brief guide on health and safety training. And that, my friends, is it. I appreciate it as a bit of a quick gallop through, but I hope it has given you some insight into the challenges that present. So if there are any questions out there, I'd be happy to deal with them.
Thank you so much, Rosemary. We do have lots of questions coming in, so I'm going to invite all of our panelists on screen. Joining Rosemary today, we have Deirdre Lynch from Burnwallace. She will answer any questions in terms of operations for Southern Ireland companies. Also joining us today, you've already met, we have Deirdre McGuire from InterTradeIreland, and she is able to answer any of your questions which relate to financial supports that are available from InterTradeIreland. So we're going to get cracking, and I'll ask the first question, which comes from Patrick. Patrick, thank you for your question. He's asked, could you advise on the guidelines for shared bathrooms between offices who also have external clients when it comes to cleaning and contact tracing? Rosemary, do you want to take that one?
Yeah, well, there's specific detailed guidance, Patrick, on cleaning available from the Health and Safety Executive, and I would direct you to that. That their risk assessment deals in very specific detail with, for example, bathroom facilities. I mean, it would be straightforward to say that shared bathroom facilities will require particular attention from a cleaning perspective. You will need undoubtedly to upgrade and make much more frequent the cleaning arrangements that are there, and certainly if they're used by visitors, that is going to have to be something that's done on an ongoing basis. I'm afraid that bathrooms are a particular area of concern. So also our canteens, anywhere where people might mingle, basically. That guidance, as I say, I could not do better than to refer you to the HSE's own website, where they actually go into quite considerable detail about cleaning requirements.
Great, and on that note then, Catherine has asked for the link to risk assessment. So Rosemary, I presume that's the same place?
That's right. If you go onto that link, Catherine, on the slide that dealt with right at the top, the HSENI link, that has the risk assessment there. As I say, it's a detailed document. Many employers will find that quite a few aspects are not relevant to them, but I think every employer going through it, I went through it myself from an office-based environment, and it was surprising the number of things that you just wouldn't have thought of, and it was helpful to think, well, does that apply to us? Should we be doing that? If there are aspects that just don't apply to you at all, well, then you don't need to do that. But I'm quite sure if you go through that document, which is very practically based, you will have done a good risk assessment.
And as Deirdre said earlier on, all the slides will be on InterTradeIreland's website, and we will issue a follow-up email to you all with those as well. Frank, thank you for your question. This is, do you have any insight on how the HSE-NI are approaching enforcement? Are there likely to be sectorial focused inspections, or will it be broader? And are any inspections likely to be focused on engagement and improvement, or will they be focused on fines and charges?
Well, anecdotally, because I haven't spoken with anyone directly in HSE-NI, but anecdotally what I'm hearing is that the overall thrust of all the regulatory bodies is that what they want to see is employers appreciating the situation and engaging with them, seeking advice, and then implementing that advice. I mean, any regulator, be they the HSE, be they the Information Commissioner's Office, be they the Equality Commission, they're all required to be proportionate regulators. And what that means is your first port of call is that they are trying to encourage adherence to best practice guidance. That's what their key priority is. Their key priority is not to go out and to penalise or sanction employers. That should be very much the last step, only really applies where perhaps a real risk has been identified and there's no cooperation to getting that. So I am quite sure that none of the regulators, and including and specifically HSE-NI, will be going out there looking to find fault. That would make absolutely no sense whatsoever. I don't know, I haven't seen any indication on their website that they're going to do sectoral investigations. You probably are all aware that there was a bit of an outcry at the start of the pandemic when they'd indicated that they weren't going to be able to do out and do inspections. And then since then, they've clarified that they will be doing inspections. I mean, obviously, if they were to get a report of a really bad situation, they will respond to that. But I would be pretty confident in assuring any employer that's meaningfully engaging with doing their risk assessment, following best practice guidance, wouldn't have anything to fear that they're going to come out in any sort of penalising way to them.
Well, that's very encouraging. Thank you. And thank you for your question, Frank. Got a question through from Ashley. Can Rosemary confirm that given the significance of the COVID-19 hazard, it isn't acceptable to not formally record the assessment of the risk? Also, what will be the test of the risk assessment being suitable and sufficient?
Well, that's a very good question, if I may say so. And I'm glad that you raised that. It is absolutely crucial to record the risk assessment, because at the end, I go back again to the health and safety order, and it places the primary responsibility on the employer to provide a safe system of work so far as is reasonably practicable. So without a written record that a risk assessment has been done, and I would suggest that on a reasonable ongoing basis, that risk assessment is revisited to see if there are any changes to it. It's going to be very difficult in the worst case scenario where an employer is faced with some kind of claim to show that it was done. There will be no point in saying, well, I did the risk assessment, you know, I had the, I remember that day and I definitely went wrong. Have it done and tick the boxes, sign it off and put a date on it and put it safely away somewhere where it can be easily accessed. In terms of overall liability, I mean, basically the key legal test is, did the employer safeguard so far as is reasonably practicable? I mean, people often say you don't have to spend £1 million for a negligible risk, but you have to look, the more risky the work environment, the more steps you are expected to have taken. And a written record of a risk assessment is a very good protective measure for an employer.
Great. We've covered a range of questions there for you. I think we've got time for a few more, if that's okay. The next one is, do I need to ask my employees every week if they have symptoms, or do I just rely on them to tell me?
Well, the responsibility certainly is on the employee to immediately notify the employer if they have symptoms. What I would suggest is that this is a period when ongoing discussion with your employees will be very important, and through your managers if you have them, or just through yourself, to constantly communicate how important it is that everyone takes responsibility for their own and everyone else's safety, and making it clear that you you expect and indeed it is expected of anyone that if they have coronavirus symptoms, that they will immediately notify you, and making that clear, very plain, that that's an expectation. And I don't think it is necessary for an employer every week to say to their employees, do you have symptoms? I think the better thing to do is very regularly to keep reminding people that they must come forward immediately and let the employer know, for their own sake, but also for the sake of all of the employees, all of the other employees.
And going one step further, another question through, what if someone does contract COVID-19? Does the entire workforce, are they all affected? Do they all have to then self-isolate? Yeah.
Well, the guidance says no. The guidance says the employee who shows up with symptoms, that person is to immediately go home and follow public health agency advice. Both the HSE and the Labour Relations Agency, both organisations say it is not necessary for the workplace to close, but obviously it is necessary to conduct a thorough clean of everywhere of the area that the employee was, and so forth. And obviously, if another individual developed symptoms, then the same situation will apply. But the guidance doesn't suggest that everyone has to be sent home or that the workplace has to close.
Brilliant. Rosemary, can you tell us a bit about contract tracing and logging of visitors? How do businesses go about those two areas, which are vast?
Yeah, well, like everything else, we're waiting on a bit of clarification from the Northern Ireland Executive about the arrangements that are going to be put in place about contact tracing. Certainly, where employers are public facing and have visitors, it's a good idea to have a record. More now than ever, most people keep a record of visitors to the premises for a whole range of reasons, and it would be useful to have those people's details in case something arose concerning them. Obviously, with your own employees, it would be very much more easy to be contacted should they, should they get some sort of alert from the Public Health Agency that they may have been in contact with someone. But as of now, I cannot give you definitive or authoritative guidance on the contact tracing systems, because I understand that actually as of today in the south an app is going to be available, but we don't have that clarification here at the minute. So what I would and what I'm certainly recommending to clients is any visitors to the premises that they keep the details of their name and address and contact details, and they explain to and that you explain to them, we will be doing this and this is why we're doing this in case an issue arises.
It makes perfect sense. I think we have time for 2 more questions, of which I'm going to combine. The questions through says, we urgently need to get PPE and we need to make sure that it meets requirements. How do we know if we have the right PPE? And also when we do obtain that, then if a staff member refuses to wear a mask, what were our obligations? What do we need to do?
Okay, well, the PPE equipment, as I said, must be fit for purpose. For example, it must fit. You will have seen the furore that emerged about folk in the health service being allocated PPE equipment that simply didn't fit. So, and that's the employer's responsibility to make sure that it is adequate to the task and that it fits. It must bear that CE mark. That's a quality accreditation mark of the European Community. If it doesn't have that, it's not of a sufficient standard. If it does have that, you're entitled to view that it does. Now, I go back to the guidance which says that you know, it will only be in very specific workplaces that people are required to wear, you know, as it were, full-scale PPE. But you can obviously make it all readily available. In terms of someone refusing to wear it, you're going to have to check: is there a reason for that? Is someone, I mean, to take an example, is someone an asthmatic and you know, and is there a difficulty around wearing a mask? And if there's a health difficulty around wearing a mask, you may have to see if that person can be in some way relocated or placed somewhere where the requirement to wear the mask would be lessened, because an employer has a difficult balancing exercise here. You can't single out someone because they have a condition which inhibits them from wearing a mask or something like that, and at the same time, if wearing a mask is seen as important, you're trying to balance your health and safety considerations. Of course, if someone has no good reason whatsoever, no underlying health, nothing to prevent them, and simply refusing, well, ultimately that could become a disciplinary issue.
Thank you. Thank you so much for all your questions that you've put to the panel just now, and I hope that we have been able to shed some light on those questions for you. Thank you to our panel for giving up their time and coming to speak to us today with the wealth of knowledge that they have. We hope that you found the event useful, and don't hesitate if you have any specific questions that you want to take offline, get in touch with us. Deirdre Maguire at InterTradeIreland will put you in touch with who you need to speak to. All that's remaining to say is thank you for joining us today and stay safe. Bye-bye.